Every now and then in the clinic, we see people coming in complaining of their vision getting blurry, or some people having numbness or even weakness. And then a very common question we get asked by such individuals is whether they may have multiple sclerosis. And it's a word that gets thrown around a lot, and some people come in, besides worrying that they might have multiple sclerosis, they probably have seen or heard of someone who has multiple sclerosis. Some of them end up in the wheelchair, and it's a very worrying diagnosis for people. Sometimes they have a lot of question, understandably so, that would they also end up in a wheelchair. So these are some of the questions I'll be addressing today. We're going to be doing some sort of a deep dive into multiple sclerosis over the next sequence of videos. But in this particular video, I will be doing an introduction in layman's terms to what multiple sclerosis is. So do stick around till the end. I am Dr. John Oluwole. I'm a neurologist practicing here in Dubai, and my goal for creating this channel is to educate and enlighten people about neurological disorders. So one of them is multiple sclerosis. So if you're coming across this video, don't forget to subscribe, share, leave your comments behind. All right. So now, what is multiple sclerosis? So multiple sclerosis is an inflammatory disorder of the nervous system. So you have inflammation affecting different parts of the nervous system, specifically the central nervous system. So what happens is the body's immune system gets turned against the body. Normally the immune system is supposed to defend the body against foreigners, including infections and cancers and other things. But now it gets misdirected and it starts targeting itself or targeting self. And in this situation, in multiple sclerosis, the target is the central nervous system, specifically the brain, the spinal cord, and then the optic nerve. Of course, we all know what the brain is, and then we know the spinal cord, which is like an extension of the brain, which is housed within the vertebral column. And then we've got the nerve that takes signals from the eyes to the brain that helps us see. So these are the three main targets in multiple sclerosis. These are the parts that make up the central nervous system. So you have these repeated immune attacks on the central nervous system, and it actually targets small areas of the nervous system per time, such that over time, over a long period of time, these small patches of inflammation consolidate and become significant and impair functioning. So per time you have lethal attacks from which the individual may or may not fully recover. Let's talk about some of the commonest symptoms, for example. I think the commonest presentation of multiple sclerosis is optic neuritis. Now, the presentation or the symptom the individual comes with will depend on the part of the nervous system that is involved per time. And then for most people, the very first sign that they have multiple sclerosis will be an attack of the optic nerve, and therefore that's what we call optic neuritis. So these individuals will develop sudden onset of blurring of vision, which tends to develop over 1 to 3 to 4 days, or up to 5 days. Usually over that short period of time, between 1 to 5 days, the vision in that eye becomes blurry, gradually more and more blurry over 1 to 5 days, and at the end of 5 days they may be unable to see well at all, in the eye that is involved. And usually, whether we do something about it or not, they tend to recover within 5 to 6 weeks. So the extent of recovery is variable, but usually a lot of people would have significant recovery because you have this immune attack that's intense inflammation, and then it clears over time. As it clears, you have recovery. So when you have this immune attack on the brain or on the part of the nervous system, whichever part is involved at the beginning, what happens is the immune system attacks the myelin. That's what we call myelin sheath. The myelin sheath is actually like a covering around the nerve cable, the nerve, and then you can liken it to the covering of electrical cables. So this covering is what we call myelin, and when you have inflammation targeting this covering, it gets damaged, and then the nerves become exposed, so they can't conduct signals smoothly and quickly as they used to. So that will cause malfunction, and as the inflammation clears, the myelin gets rebuilt and the individual starts to recover. But I must also add that recovery depends on the extent of damage, because if the inflammation is severe, it could actually go beyond just the myelin sheath. It can also damage the underlying nerve substance. And when you have nerve substance damage, the recovery may not be complete. Now let's shift gear from the eyes or optic neuritis to the other common symptoms. Some people experience numbness. So the attack in this case would be in the part of the brain that helps us process sensory information from the body, or even the spinal cord, the aspect that conducts signals, sensory signals. So if these areas are involved, then such individuals are going to manifest with numbness that develops over a similar period, over like a period of 1 to 5 days, and then it persists for a while and starts to clear over the next couple of weeks, up to 6 weeks. And then depending on the extent of damage, they may or may not have full recovery. But the rule usually is there is some sort of recovery, significant recovery, because you have this attack of inflammation, and then you have recovery following it. And then the attack, tends to develop or evolve over a short period of time, between a day to 5 days, and then you have slow recovery thereafter, running into weeks. And that's the typical behavior of multiple sclerosis. The other common symptom that people have is weakness. I remember a young lady around there about 2019 who came in with weakness, sudden weakness on one side of the body, the arm and the leg. This girl probably was about, 19 years old at the time? Yeah, 19 years old, 19. And she came in with sudden paralysis of one side of the body. And when we did investigations, we realized that was the onset of multiple sclerosis. We call it MS for short. That's the short form of multiple sclerosis. So a lot of times we say MS, and that was the beginning of MS for her. And eventually she made significant recovery, and she's doing quite well today. So that's another common symptom. So at the beginning, in the first few years after people develop multiple sclerosis, these are the signature attacks. They continue to have these recurrent attacks, patches of attacks here and there, over time, separated by months to years. Some would have the first attack and then they recover over weeks, like I said before, and then let's say a few months down the line they could have another tiny attack, several months down the line they have another one, or years later. So the attacks can be separated by several months to years, and then over time. So that's what they continue to have. They continue to have those relapses, and they recover, relapse, and then they recover. And then over time, all of the, relapses they've had now begin to take a toll on the nervous system. So cumulatively over years, 10 to 15 to 20 years down the line, then they may begin to have significant disability accruing from this. And this is what may eventually affect their walking ability, may affect their memory, may affect their bladder function, and some of them may end up in wheelchair. Now, will everyone end up this way? Not necessarily so, especially these days when we have a lot of very good treatment. I seem to be getting ahead of myself, so I'll be introducing the treatments in my subsequent videos. But for today, I just want to briefly introduce the concept of multiple sclerosis, which is an inflammatory disease that occurs in small patches and recurrently over years, and then eventually can accumulate and lead to disability if not cared for. And then when the symptoms develop at the beginning, they develop over, they evolve over a short period of time, between 1 day to 5 days. They become maximum, and then they slowly recover over time. The primary target is the myelin covering of the nerves, which gets damaged in the inflammatory process, and then slowly it gets rebuilt. But of course, if the underlying nerve is damaged, then it can be more severe, and recovery may be less complete. So thank you for watching today. In the next video, I will be talking about the risk factors for multiple sclerosis. I'll be talking about the various types of multiple sclerosis, and eventually I'll also do another video on the treatments and follow-up of people with multiple sclerosis. So this is just an introduction and an appetizer for you to understand what multiple sclerosis is. I do hope you will follow this channel so you can benefit from future videos. Thank you for watching today, and I'll see you again next time.